Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
How has the current opioid epidemic affected the number of pregnancies in opioid-addicted mothers?
It's increased it. I mean, it's obvious that if you look at the data going forward, it's like a straight line going up from, I'd say for the past 5 years, maybe a little longer than that, but for the past 5 years, it's increased steadily.
Are opioid-addicted women at a higher risk of developing complications during pregnancy?
Absolutely. Opioid addiction, some of it is the social economic problems that go along with it. They tend to smoke more. They tend not to have a very healthy diet. They have more complications with preterm labor, more complications with smaller babies. So yes, they do have complicated pregnancies.
What effects do opioids have on a developing fetus?
Opioids are not thought, and we do not think that they actually cause any anomalies with a baby. In fact, what we say, they're not teratogenic. They don't cause a structural problem with a baby. What they do though is, if you continue to take opioids during pregnancy, the baby, when it's separated from that environment, because the opioids cross the placenta, the baby, when it is born and is separated from the mother and the placenta, it then needs to withdraw from those opioids.
Is it safe for a woman to stop taking opioids abruptly if she becomes pregnant, and are there dangers in doing so?
A woman should not stop opioids abruptly, and really we do not recommend that women even wean themselves off of opioids during pregnancy, because the fetus will withdraw and we won't be able to monitor the fetus as well as we can the baby once it's delivered. And the other reason, honestly, not to withdraw opioids during pregnancy is that there's a very high rate of relapse. It's a very stressful time.
What type of care is available for an opioid-addicted mother?
There is medication-assisted recovery, so that a woman who is taking street narcotics, street opioids, can be placed on a set dose that could be increased or decreased according to how she feels of a synthetic opioid. Methadone is the one that we know most commonly. And it is adjusted, the dose is adjusted so that the craving for opioids is decreased during pregnancy, but even if somebody's not pregnant. And the idea is that, yes, the fetus is still exposed to the opioid, and yes, the baby will still need to withdraw, but you remove all those difficulties.
Is there a certain part of the population that this affects more than others?
It's not only in the cities, and it's not only in a certain population. It is really across the spectrum of socioeconomic status, of race, of place. It really is very prevalent in all situations.
How can methadone be used to protect the health of an unborn child?
The main reason to give a mother methadone is to prevent her from taking illegal, unprescribed medications, with the inherent risk of the one that we fear the most is overdose. So when you take a dose of fentanyl or a dose of any kind of narcotic from the street, it is very difficult to know exactly what you're getting, and hence there's been along with the opioid epidemic, has been this increase in death related to an overdose.
What is the Green Clinic and the Moms Do Care program?
So it's wonderful. Both of them have been really wonderful additions to what we can do at UMass Memorial. So I'll start first with the Moms Do Care, which is a grant from SAMHSA, which is the National Organization for Addiction Services, and it's done through our Massachusetts DPH. And so it has provided training for peer moms, and peer moms would be women who they themselves have had a pregnancy while they had opioid use, and now are in recovery for a strong period of time, and they can help women sort of mentor them through the pregnancy and hopefully mentor them through all the steps that are necessary for them to stay in recovery during pregnancy. It also has involved a big portion of education for the entire hospital system, so that I think people understand a little bit more about addiction during pregnancy, and they understand the purpose of methadone. So I think that's been helpful, really helpful for women when they come into labor and delivery. The Green Clinic now is something that is a little different because that's ongoing care. So previous to the Green Clinic, what has happened is that women who needed treatment for their opioid addiction were basically just put into everyday clinics. So they were just sort of sporadically placed into people's clinics, and there wasn't that special understanding of what they needed, of social work, of all the support that women with opioid use during pregnancy would need. They also usually had to get their methadone at one site and then get their prenatal care at someplace else. And so what the Green Clinic does is it gives the possibility of women getting all their care in one place, and with all the support that's necessary, social work, and people who really want to take care of women with opioid use during pregnancy, and people who really, I think, what I would say, maybe understand their struggle a little bit more. So both of those have been really positive changes at UMass Memorial.